Good morning, everyone, and you're welcome to the new session of HLTINF006, which is Apply Basic Principle and Practice of Infection Prevention and Control. This unit describes the performance outcome, the skills and knowledge required to apply basic infection prevention and control principles in our workplace. Either we are working in the healthcare industry, construction, food industry. It gives us the basic understanding on how to actually implement standard and how to avoid any transmission-based infection. So it gives us the transmission-based precaution, as well as how best we can respond to the risk associated with infection control in our job or in our workplace. At the end of this session, we are expected to be able to understand more what infection control is. We are expected to identify the role of infection prevention and control in our work area. We are expected to understand more about following the standards and transmission-based precaution for infection prevention and control in the work settings, as well as responding to potential and actual exposure of infection risk within our scope of work. As an healthcare worker, as an aged care worker, or even disability worker, we will be working with people that have a fragile immune system, which if we are not really supporting, or if we are not following the right procedure when it comes to infection control, we can actually affect them in a very grave way. But before I go forward, I would like to acknowledge the landowner. I would like to acknowledge the First Nation, the past, the present, as well as the emerging. So what do we mean by infection control? How do we prevent this? Infection control prevention, that is infection prevention and control, IPC, is method through which people can prevent infection from occurring. Why do we need to prevent infection from occurring? As I said earlier, we will be working with people with low immune system. So small action that we are taking, whether we take a very good personal hygiene or we look after ourselves, washing our hands, or even putting on gloves while we are supporting them, is a very big deal, because it can prevent us from affecting them in a way that we might not really know. So this presentation will go through how to apply infection prevention and control to you, or to your situation as an ally, as an healthcare provider, as an individual support worker, or as an aged care worker. Also, infection prevention and control at work ensure that diseases does not prohibit you from accomplishing your work or personal goal. What do we mean by this? If you're working in an aged care, there might be some time that some of your clients, or even during the past COVID, we understand that COVID is a very infectious disease. However, when we follow the right policies and procedure, it does not stop us from accomplishing our work, nor does it stop us from achieving what our personal goals are. Why are we able to overcome this? We were able to overcome this by following the necessary policies and procedure that is set out by our company. So when we understand what are those standards, what are those guidelines that is expected of us to follow, or that is expected of us to use, then we can be rest assured that we are safe, at least like 70 to 80% safe when we follow the necessary guidelines. So standards and guidelines are documents developed by industry to ensure the following. 1. Services, product, and process are at minimum expected quality. 2. The outcome of your work reach the quality sets by the industrial experts. 3. Here are some examples of the standard and the guidelines that we follow in Australia. One of them is the Australian guideline for prevention and control of infection in healthcare. Another one is preventing and controlling infection standard of National Safety and Quality Health Services. All this standard that is in place, their major expectation is to keep ourselves safe and to keep our clients safe. Identify infection risk and hazard. Of course, the standard of also enables us to identify risk and hazard associated with our job role. So while we are identifying if any of the following potential hazard exists in our workplace, it is very, very important to keep the appropriate record of whatever we find. For example, if you're working in an aged care or you're working in disability sector, do we have contaminated food in our disposal? If we do, we should try as much as possible to eliminate this hazard. How do we eliminate hazard of contaminated food? We should try to avoid any contamination, maybe cross-contamination during while we are cooking the food, or even after the food is ready. If they've had some and we want to store some away, we should label them appropriately and put them in the right temperature to be able to preserve them. Another form of risk in the healthcare industry is contaminated water. Is work area, do we have contaminated water? If we do, we should work in a way that we can eliminate this as well. Incidental exposure, cuts from contaminated objects. Most of us that we are working in the aged aid or even in the disability area, there might be time that we are supporting our client to do some personal hygiene that we are likely to cut ourselves. If this occur, or in this situation, of course, the level of risk or the level of exposure to risk is higher because we are already cut ourselves, and if any infection gets into our body or get in contact with our body at that time, it goes straight into our bloodstream. So in order to stop or in order to avoid this, we should cover that area with the necessary equipment. So we should follow our organization policies and procedure in line with this. Direct contact with an infectious substance, contact of infectious substance with wound and liaison, just as I've said earlier. Poor ventilation is also a risk when it comes to infection. Workplace vector, dry work area, ill colleague can be a very strong form of risk and hazard in the healthcare sector. So all these are some of the risks that we can easily run into. So it is our responsibility to be able to identify this risk and put appropriate measure to control them before it actually escalate or before it goes out of hand. So that is why we said we need to cut or break the infection control chain. What do we mean by this? The chain of infection is a way by which diseases move from one source to another, or that is, diseases move from one person to another. Excuse me. As we can see in this diagram, we have the susceptible host, we have causative agent, we have the reservoir, we have portal of exit, we have means of transmission, we have portal of entry. All these stages are stages whereby infection move from one person to the other. For us to control any infection, we should try as much as possible to break the chain. If you go to the toilet and after using the toilet you don't wash your hand appropriately, of course you become an agent. Then you be the susceptible host, that is transferring or causative agent that is going to be taking this infection from one person to the other. And if, let's say, after using the toilet to which you are susceptible host, then you don't wash your hand, then you become the causative agent. From there you might use, or you might decide to use the computer system in your organization. Then the moment you touch that computer system, the computer system is affected. Then you put the infection on that computer system, that the computer system become like a reservoir. That is where the infection is resting at the moment. Port of exit, of course, that might be when someone try to sneeze, and when you sneeze, instead of you covering your mouth, you don't cover your mouth and you allow the droplet to actually go into the environment. Then that is, you've sneezed out, and that is port of exit. Means of transmission, once that droplet is in the air, what is the means of transmission in that place? Maybe is it airborne? Is it something that we need to contact by touching them? And if it's airborne, someone that is coming in from somewhere else that they are not using mask, once you sneeze into the air, they can easily breathe in that particular air. Then they become portal of entry from their nose, their mouth, or even their eyes. So these are some ways that we can understand how infection could be spread. So it is our responsibility to make sure that we break the chain as soon as possible. Pathogenic microorganisms are some other infections that can make us feel bad. So this differ from microorganism, from one microorganism to another. We have non-pathogenic microorganisms. These are harmless microorganisms because they do not cause harm, diseases, or deaths to their host. While pathogenic microorganisms or pathogens are those that actually cause harm to their host. So pathogens include virus, bacteria, fungi, and parasites. It can cause the following, they can cause the following: exposure, colonization, infection, and diseases. Below are workplace practices that can help lower the possibility of exposure to exposure to this form of pathogens. One, when we use the appropriate PPE, that is personal protective equipment, when we clean and disinfect high touch area and item regularly, just as I said earlier, when you're working with your computer system, because we touch this area so many times. Some other area or high traffic area in our workplace might be the mouse, can be the place where we switch off the lights. So all these are some of the areas that we need to think about when we are supporting our client. Getting immunization against infection diseases is also very, very important. That is why in healthcare industry we are expected to have COVID vaccination in order not to put ourselves or our clients in arm's length. So the techniques or mode of transmission are referred to the means of transmission, and they are often known as routes. This mode can be divided into two. We have direct contact transmission. Direct contact transmission can include contact transmission, droplet, as I said earlier, or airborne, when you sneeze into the air and someone actually breathe that kind of air inside. Indirect contact transmission might involve surface or object contamination. If you touch a particular place after being infected and another person comes around and touch the same place, then that is indirectly you are actually spreading infection. Penetrating injuries, when you have injuries and you allow infection to come into your body. And lastly, if you are a vector, then that is another form of indirect transmission of infection. This is where we are going to be calling it a day today, and in our next video we are going to be starting with identifying roles and responsibility in relation to infection prevention and control. Until then, remain blessed. Thank you.